Cleft palate. The palate is the roof of the mouth and separates the nasal and oral cavity. It has two parts, hard and soft. A cleft palate has a cleft that works bilaterally or unilaterally and can range in size from a small hole to a large one. A cleft palate can affect the hard and soft palate separately and socially and may cause cleft lip. Puppies can be born with a cleft palate, or a cleft palate can occur from an injury. A cleft palate is fairly common in dogs, but many puppies born with a cleft palate do not survive or are killed by a breeder. The only treatment for a cleft palate is surgery to close the opening, although not all dogs with a cleft palate require surgery. It is important to get a diagnosis and a treatment recommendation from your veterinarian. Cryptorchidism. Cryptorchidism is a condition in which one or both testicles for a dog fail to descend, and it is common in small dogs. The testicles should fully descend by the time the puppy is 2 months old. If a testicle is retained, it is usually malfunctioning and can become cancerous if not removed. Suggested treatment is to neuter your dog. When castration occurs, a small incision is made to remove the undescended testicle. The normal testicle, if present, is removed by the regular method. Lactating disease. This condition occurs when an extra row of eyelashes, known as a dischidia, grows over the sebaceous gland in a dog's eye and protrudes along the edge of the eyelid. This irritates the eye, and you may notice squinting or rubbing of his eyes. Eyelashes are treated surgically by freezing excess eyelashes with liquid nitrogen and then removing them. This type of surgery is called cryotherapy and is performed under general anesthesia. Ectopic cilia, an anomaly of eyelash growth where excess eyelashes grow across the eyelid inward. There may be one or more cilia outside the uterus. Clinical signs of discomfort vary according to the number of abnormal cilia and whether they are fine or coarse. This type of eyelash abnormality causes special eye irritation and increases the likelihood of causing corneal ulcers. Treatment consists of treating any corneal ulcers that have occurred with antibiotics and surgical removal of the abnormal follicle. Ectropion. This defect, which usually appears at the age of 6 months, causes the eyelid to slide inward, causing irritation or injury to the eyeball. One or both eyes can be affected. If you have ectropion, you may notice him rubbing his eyes. The condition can be corrected surgically if it is not overcome in adulthood. Fold dermatitis. Inflammation of the skin caused by folds of skin in which friction or moisture retention occurs. It is more commonly found in breeds that have folds in the skin, such as the Pikingese. Signs of folded dermatitis are redness, sores, and odor, and the dog can be affected on the tail, face, lips, vulvar folds, and any other folds on the body. Treatment for fold dermatitis varies with the affected area, but may include surgical excision of folds or tail amputation in case of fold dermatitis. It may also include topical antibiotic ointments. The best course of treatment is to properly maintain your dog's coat to prevent this condition. Hydrocephalus. It occurs when cerebrospinal fluid, CSF, builds up in the brain due to a birth defect, obstruction, or perinatal trauma, which puts pressure on the brain. This usually occurs in young dogs under 18 months of age and older dogs over 6 years of age. If hydrocephalus is left untreated, the dog will die. Treatment consists of medical treatment and surgery in which the blockage is removed or a shunt inserted. Dry keratoconjunctivitis. Dry keratoconjunctivitis, or dry eyes, occurs when the eye does not produce enough tears to remain moist. A vet can perform a Schirmer's tear test to diagnose dry eyes, which can be controlled with medication and special care. This eye condition requires lifelong treatment and care. Mitral valve disease. This defect in the mitral valve of the heart causes a backup of blood in the left atrium, known as mitral valve regurgitation. This makes the heart less efficient at pumping blood. It is the most common acquired heart disease, affecting more than a third of dogs over the age of 10. There are several strains genetically predisposed to acquiring the condition at a much younger age, including the Pikingese strains. If your veterinarian hears a heart murmur, Pik should be evaluated by a veterinary cardiologist. Progressive retinal atrophy, PRA. This is a degenerative disorder of the eye that eventually leads to blindness caused by the loss of photoreceptors at the back of the eye. PRA can be detected years before a dog shows any signs of blindness. Fortunately, dogs can use their other senses to compensate for blindness, and a blind dog can lead a full and happy life. Just don't make moving furniture a habit. Reputable breeders have the dog eyes certified annually by a veterinary ophthalmologist and do not breed dogs with this disease. Exposure to keratopathy syndrome. This syndrome can be caused by a number of factors such as exophthalmos, which is a bump in the eyeball, macroblepharon, which is a large opening to the eyelid, and lagophthalmos, which is the inability to close the eyelid completely. These factors expose the cornea, resulting in an inability to blink properly and easy tears to evaporate. The syndrome can lead to corneal ulcers and corneal pigmentation that may cause visual impairment. The signs are generally red eyes, increased tears, and scratching in the eyes. Treatment for exposure to keratopathy syndrome usually has different surgeries, but tear replacements have been used as a temporary treatment. Intervertebral disc disease. The spinal cord is surrounded by the spine, and between the bones of the spine are discs between the vertebrae that act as shock absorbers and allow normal movement of the vertebrae. The tablets consist of two layers, an outer fibrous layer and an inner gel-like layer. Intervertebral disc disease occurs when the inner, gel-like layer protrudes into the spinal canal and pushes against the spinal cord. Spinal cord compression may be minimal, causing neck or back pain, or it can be severe, resulting in loss of sensation, paralysis, and loss of bowel or bladder control. The damage from spinal compression may be irreversible. Treatment depends on many factors, including the location, severity, and length of time between injury and treatment. A dog confinement may be of little help, but surgery is often required to relieve pressure on the spinal cord. Surgery is not always successful. Care bikinis make good apartment dogs, and of course they'll be equally happy at a mansion. They love to run and have fun but need a fenced area because they will explore and may wander around. Bikinis appreciate going for walks and will be an excellent company to commute around the neighborhood with you. They will run around the house, especially with another dog or dog. Despite their heavy coat, the Pekingese is a household dog and should not live outdoors. Their short noses make them sensitive to heat, so they need to live in an air-conditioned environment. Peaks are stubborn and can be difficult to train. They will never respond to harsh corrections or training methods. Reward them anytime they do something you love, and be creative in convincing them that what you want them to do is their idea and it is worth their time. Feed recommended daily amount, 1/2 to 1 cup of high-quality dry food daily, divided into 2 meals. Note: how much your adult dog eats depends on his size, age, build, metabolism, and activity level. Dogs are individuals, just like people, and they don't all need the same amount of food. It almost goes without saying that a very active dog will need more than just a potato dog. The quality of the dog food you buy also makes a difference. The better your dog's food, the more direction it will be toward feeding your dog and the less you'll need to shake it in the dog's bowl. Peaks are intended to be chubby, muscular dogs that feel heavy when raised, but they should not be fat. Keep Pikingese healthy by measuring their food and feeding them twice daily rather than leaving the food outside all the time. If you are not sure if he's overweight, give him the hands-on test. Place your hands on his back, and your thumbs along the spine, with fingers spread down. You should be able to feel his ribs but not be able to see them without pressing hard. If you can't, he needs fewer bonbons and more exercise. To learn more about feeding a peak, see tips for buying the right food, feeding your puppy, and feeding your adult dog. Coat color and grooming. A Pikingese wears a long, coarse, and straight coat that stands apart from the body like a halo of fur. Under the top coat there is a thick, soft undercoat. According to its description as a lion dog, the Pikingese has a noticeable mane on the neck and shoulder area, with the coat on the rest of the body somewhat shorter. While it should be long and prolific, the coat should not obscure the shape of the body. Long feathers are found on the back of the legs and on the toes, with longer fringes on the ears and tail. Pikingese coat can be any color or any markings, including black and sepia, dark brown or dark red, and the subtle color, which is white in another color. He may or may not have a black mask. The solid white Pikingese was held in high esteem by the Chinese and is still popular today. Regardless of the color of the coat, the exposed skin of the muzzle, nose, lips, and eye edges are black. Unless you see it, you can brush your Pikingese coat weekly with a small bristle brush, curry brush, or hair loss comb. Before brushing hair, apply a little water to the coat to prevent hair breakage. Brush all the way down to the skin. If you pass over the top of the coat, it won't come out the dead hair that forms mats and tangles. Continue spraying as you comb through each area of the body. Use a metal comb on the feathers and the fringe on the legs, ears, and tail. These areas tangle easily, so comb them daily. Clean the face and around the eyes daily with a damp cotton ball to prevent problems with the skin folds in the area. Keep skin folds clean and dry to prevent infections. Anytime your peak gets wet, dry the skin folds completely so that no moisture remains. Wash a Pikingese once or twice a month as needed. Use shampoo designed for dogs so that you don't dry out the coat. You can also ditch dry dog shampoo and then brush it. Trim the hair to the feet to prevent mats and foreign objects from getting tangled there. Trim nails regularly, usually every 2 or 3 weeks. If you can hear them clicking to the floor, they are very long. Teaching your peaky puppy to accept brushing at least weekly, ideally daily, can help prevent dental disease in later life, which is a common problem in young dogs. Children and other pets. A Pikingese is not a good choice for families with young children who may almost inadvertently treat him. Pik will not stand constipation or tingling and will not hesitate to stand up for himself. Always teach children how to approach and touch dogs, and always supervise any interactions between dogs and young children to prevent any biting or pulling of an ear or tail from either side. Teach your child to never approach any dog while he is sleeping, eating, or trying to take the dog's food away. No dog should be left unsupervised with a child. Piks prefer a Pikingese company, but with early socialization they can learn to get along with other dogs, and cats, and possibly even control dogs over 20 times their size. Rescue groups. Often a Pikingese is bought without any clear understanding of what goes into owning one. There are many Piks that need adoption or sponsorship. There are a number of rescue operations that we have not listed. If you don't see a rescue listing for your area, contact the National Breed Club or local breed club and they can direct you toward Pik Rescue. Don't forget to subscribe to the channel, activate the notifications, and leave us a comment. Thank you for watching.